There's a saying that the NHS is one of the most data-rich organisations in the world, but one of the most information-poor. We collect data about everything that we do in the NHS, and data that's collected routinely by GPs is one of the richest data sets that we have access to and tells us most about our population.
Within 3 months of using this report and implementing it in all the practices in Slough, we found at least 24% reduction in the A&E attendance and a significant reduction in the admissions as well.
My first involvement with the ACG system and with Sollis was back in 2010 when I was still working within the NHS and I was a customer. I enjoy working with Sollis for a number of reasons, one of which is that most of their staff have worked within the NHS, so they share my values.
Essentially, every admission to the hospital can put the taxpayer down by at least £1,500 to £2,000. Some of our complex case patients were getting admitted 3 or 4 times in the last 6 months.
The first thing I did with Dr. Nanda and other people in Slough CCG was to try and understand the question they were asking of the data and of the information. What was the problem that they were trying to solve?
To get that group of patients who are consuming the most resources in the community, why are they getting so many admissions to the hospital? Why are there so many GP visits? And why is there so much spending in the medications for them?
What Clarity Patients does is make that information accessible to end users and allow them to see that information in a more graphical and user-friendly way and allow them to generate their own reports. You can have 2 views of the data. You can see the data that's been completely anonymised, and people that work within CCGs can use that to profile their populations and gain a better understanding of, for example, how disease is distributed across a population, but without ever knowing who those individuals are. GPs can run a report, and within that report they will be able to see who those individual patients are who you've identified as being at risk.
The smart data tools like ACG and Sollis really gave us on a plate what different groups of patients and age groups consumed in terms of the healthcare resources. The interesting bit out of all this, apart from the general theme of 5% of population took about 43% of resources, we also found that the age group between 50 to 64 with multimorbidities consumed a lot more in this healthcare economy compared to the previously assumed just the elderly take a lot of time and resource as such.
The platform grows and evolves over time to meet the changing needs of people that are working at the front line in the NHS.
By implementing some small changes, we started seeing these patients for a period of 20 minutes every 3 weeks. We gave them dedicated phone line so that if they have any issues they want to discuss, and they had this access 24/7.
Few of the patients phone often because they're finding it difficult to breathe, they need advice as to what to do. And I can get to a doctor straight away, whether it's a telephone triage doctor or Dr. Nanda or one of the other doctors.
The beauty of what Clarity Patients and the ACG system does is it combines routinely collected data from GP practices with data from hospital services and allows you to gain a picture of what's happening across the whole population.
My message to other colleagues of my other CCGs, please do engage in this kind of process of interrogating the clinical system with smart tools like ACG and Sollis to get that holy grail of patients whom we can intervene frequently and manage them in the community.
I think the partnership between the 3 organisations works so well because we have a common goal and we have a mutual respect for each of our roles within that partnership. I don't think that if any one of us tried to solve the problem that we've solved on our own, it would have worked. The power has been by 3 complementary organisations working together.